Hi there. We love doing live webinars where we can share best practices and topics of interest to you. To learn more and to access the resources referenced in this video, please scroll down to the video description. Without further ado, I'll turn you over to the team.
And I do want to just, make a warm welcome to all of you and just say a couple things about Steve. I think I met Steve about 6 years ago. We do in Ancona a blog as well. And, it's interesting because Steve is all about helping home care marketers grow their home care business. But I have to say, following everything that I've seen from Steve over the years, they've helped me grow our software business for home care as well. And, and a lot of things about really organizing our referral partners and building relationships and the confidence and all those kinds of things have really been great and that kind of thing. So I have 4 bullets about Steve on the chart. So he actually started early in his career, and he was a home care marketer in an agency that had 16 clients, and he grew it up to $5 million a year. And and he could help you do that too. And I know you're saying, from my lips to God's ears, right? Because that's what we all want to do. But really, Steve has a great bunch of recipes and formulas and that kind of thing. I've met him live at a few conferences. Again, we blogged, we've shared his ideas, and a lot of times people come and they fill out a form on Ancode and they're like, hey, I really need help growing leads and growing marketing. And when that happens, I always direct them right to Steve's agency. And I've met a couple of Steve's staff as well and say, hey, could you follow up with this individual? And as you'll find out, Steve's team, is really great, and they really are, happy to take a call. His seminars themselves, are really about blowing away the competition, and I think, it's so fun and energetic. And I don't know if you watched some of the trailer videos that we sent out, but really, fun and energetic stuff. But the last thing I'll say before I turn it over to Steve is he's just a great guy. I've met him live, and as much of a personality as you'll see he is online here, he's also just a very humble human being who's overcome some personal kind of things from earlier in his life and made a really fantastic life for himself. And he's also made a great life for a lot of home care agencies. So without further ado, I'm going to see if I can work through this little board here and figure out how to change the presenter to Steve, and then it'll be all you.
All right, everyone. How you doing? Steve the Hurricane here. And Ken, just thank you so much for that beautiful introduction. And it's an honor and a pleasure to be here and to serve you and to serve all of your following and having this opportunity to share this with you. And I love what I get to do, and I know you and I we've been talking for a long time now, and I'm just again honored to be here. And it's funny what you had said about overcoming adversity. My 8-year anniversary of when I started Hurricane Marketing Enterprises is Saturday. So Saturday, June 20th, makes it 8 complete years, and it's the beginning of my 9th year in operation. And this is a time where I always reflect and I look back. And when I very first got started with the business, and this is something that I want to say to every single one of you out there, no matter where you are in business, there's never a good time to begin anything, right? There's always a reason why you can't do something. And when I started Hurricane Marketing Enterprises, I had an 18-month-old child. I had a baby that was 3 months old, our second child. My wife, because of choices that my wife and I had made, we decided that raising our children was the higher priority than having 2 incomes in our household. So we made sacrifices by she stopped working to stay at home and raise our children. And so now we only had 1 income. And I wanted to drop that income to start something new. And making it worse, right as soon as I began the business, the company that I had sold my home care business, Care Choice, to, they sent me a cease and desist, which basically stated I was not allowed to work with any home care company in the state that I lived in. So you want to talk about adversity. When I was getting started, I wanted to cry. I'm sure I did cry during that moment, but I continued to push forward. I found a way. I relocated my family to Florida, did a consulting contract down in there, built my business, working in states outside of the state that I was from, New Jersey, eventually moved back to New Jersey. That non-compete lifted, and then we continued to move forward, and the rest is history, where, you know, today I have helped hundreds of home care business owners in the United States, and as of this morning at 7:30 a.m., we sign on our first client in Ireland. So that Ireland is our first Irish client, and that's now the 7th country around the world that we have reached to help influence sales and marketing and scaling of people's home care businesses. And we have helped people generate more than $1 billion of revenue during these last 8 years. And it has been such an amazing ride. I truly love the home care business. I love what our mission is. And as Ken said, I'm a fun-loving guy. I'm a huge dork. I'm wearing my Dragon Ball shirts. I'm a big anime cartoon fan. My kids love it. So I'm like the fun dad at the household. All the fathers out there, happy Father's Day to you. It's coming up on Sunday. So we're getting started here. And when I was asked to do this session on, you know, best practices for Medicaid agencies that want to scale and grow, I was like, this is a perfect opportunity to talk about a lot of the things that I work with on my clients who have Medicaid businesses. Many people don't realize this. We don't just focus on private duty alone. We have many clients that are private duty. We have many clients that are Medicaid that want to grow their Medicaid business, that want to grow their private pay side of it as well. We have many clients that are home health, many clients that are hospice. So we kind of work with all of the home-based providers under the home care umbrella. And something that I want to put out to you with this, as you know, we have a limited time together. So this morning, we sent every single one of you an email from us. You may or may not have seen it. It might have been in your spam folder. So I want to let you know that because we only have a limited amount of time together, as part of something that I'm doing to help rebound the industry, to help get America and other countries back on their feet after this COVID-19 pandemic, and we're still in the middle of it, but I want to help you grow your businesses. So I have decided to donate $50,000 worth of my services to the public, and that's you. So if you're not a client of ours, we're going to give you one free coaching session as my thank you for being on this webinar with me here. So this way, if I have to cut short or I can't answer all the questions at the end, you can still get your help and your questions answered with one of my coaches. Now, I charge $250 for this. We're going to give this to you. All you have to do is email info@homecaremarketing.net. They will send you a survey with best contact information and whatnot, and then we'll schedule it sometime over the next 2 to 4 weeks for you so that we can help you, as Ken said, blow away the competition. So that's from me to you. Make sure you write down that email, info@homecaremarketing.net. Email us, say, I want my coaching session. We'll help you set that up, and we'll do that over the next couple of weeks with you. So the first thing that I want to jump into as we're going through the order of business here is I want to talk about P&L statements. When it comes to the Medicaid providers that we work with, or people who offer both private duty and Medicaid, you have to take a look at your margins. I know around the country, some reimbursements in some states are better than others. For example, I was actually just talking to one of my clients in Delaware. Delaware has a really good Medicaid reimbursement. The Medicaid reimbursement is very close to what their private pay price is. Massachusetts is another state that has a pretty good reimbursement. But there are other states, like 35 to 38 out of the 50 states in the country, where the Medicaid reimbursement really isn't that good. You know, you happen to be here in New Jersey, and you may look at my hair and be like, wow, Steve, you got a lot of hair on your head there. The reason why I got a lot of hair on my head is because we haven't even opened up our barbershops yet. So I haven't been able to get my hair cut since February. So my hair is really long. I got like a mullet going on in the back here. But the reason why I'm bringing this up is because New Jersey and many states like New Jersey, the reimbursement rate is so low that in order to generate the kind of revenue that allows you to live and not live a rich life. I mean, like, you know, we all want to live a rich life, but to generate the amount of income needed to live a good life, owning a business where it's available 24/7, you have to be available 24/7. You have to run everything. You have to hire everything. If there's something that happens at 3 o'clock in the morning, that's your problem. If something happens at 2 o'clock in the afternoon, that's your problem. 11 o'clock at night, that's your problem. You have to deal with this 24/7 business. You should make a good living. And in New Jersey, to be able to do that, you have to take care of like 500 patients or greater to make it worthwhile to accept all the Medicaid. And there's not much you can do about it. You are 100% relying on the government for reimbursement, which means that you're floating caregivers' salaries, you're floating payroll for your office staff for, anywhere from 30 to 90 days. In some states, it's worse. I've heard nightmare stories from my Medicaid clients. And then you have to deal with compliance and regulations. And every year, the regulations change and update, and the compliance change and update. And with these changes and updates, it's slowly eroding our margins. And so when I look at P&Ls, and this is the data I'm going to be sharing with you is from the most recent Home Care Pulse. I don't know if you all participate in Home Care Pulse or you get the Home Care Pulse report. The Home Care Pulse report just came out on Tuesday of this week. So 2 days ago, the 2020 11th annual Home Care Pulse report came out. But the data I'm going to show you is a straight screenshot from the Home Care Pulse report. So you look at this right here, and so you see, this is P&Ls of people, and this is based on revenue. Now, these businesses that are surveyed many are combined businesses, meaning they have private duty and they have Medicaid, and they're collecting together. The one thing that always jumps out to me, and let me bring my mouse over so we can see this here. So you see my mouse, all right? So, if you're a master, you're doing over $5 million a year in revenue, and then you can see the ranges, and then the median of each person surveyed that falls into each of these ranges here. The one thing that jumps out to me that we really don't have a lot of control over is the compensation of our caregivers. So whether it's private pay exclusively, Medicaid exclusively, Medicare Advantage, some combination of the three, we have to pay our caregivers a certain amount of money. They're not going to take the job. They're not going to do a good job if we're underpaying them. Hospitals and skilled nursing facilities, they're competing for the same caregivers as we are, and they're going to pay more than we will. So we have to pay a certain amount. There's not much control we have over what we're paying our caregivers. But when I look at this line right here, all right, and it's this line right here, caregiver wages, the P&L, the part of it that has to jump out is your total care wages, not the direct expenses. So workers' comp and the benefits and all of this stuff, this is all on top of it. But even this number here, this direct care expenses should be about 60% of whatever your total annual revenue coming in. 60% is the number. And then this line right here, the caregiver wages, should be 50%, because that 10% cushion is for all of these other things in the middle here. So when you look at this line here, and this is based off of the median numbers, most people are paying more money than that 50%. Not a tremendous amount, but you will say, between 52 and 55%, which means that you're running into a potential cash flow issue. That is the reason why I'm here right now. That's why I'm here talking with you. This is why I'm bringing this up, because if one regulation comes up, one change to compliance that costs more in doing business, now our margins suffer further. And we all know this. They're quick to give us regulations and quick to give us changes in compliance, but they are very slow to give us an increase in reimbursement. So do this, do this, do this, and eventually we'll give you some more money to offset what we told you to do years ago, right? And so we have to be able to keep this. Now, I'm not telling you to underpay your caregivers. That is not what I'm saying. But what I am saying is this is where you have to find the balance between your Medicaid business and your private pay business. You have to blend them together. Like a good 30% of my clients, we're working with well over 150 clients right now today. A good 30% of them, so we're talking about 50, 60 people, have Medicaid businesses, and they've come to us to help them grow their private pay side to offset this cost. One of my favorite clients is a client that just signed up with us 4 weeks ago. Love this man to death in Arizona. He has a multi-million-dollar business. He's in the master's group here, right? So he's doing over $5 million a year. But he reached out to me because he's like, my Medicaid is like 80% of the revenue coming in, and I just got some changes, and that has me worried that if I don't increase my private, I'm going to run into some problems in the very near future if I don't make changes now. And that is the point of what I'm discussing here with you. And then just another look at the same thing. They're showing you averages based on where you are in the United States, and still the same thing remains. People are paying more than 50% of their total revenue coming in to the salaries of the caregivers. And even if you look over here, these margins are not as healthy as they should be either. We have to make sure that the business is healthy. That is super, super important, because whether you're taking care of 50 patients or 250 patients, it doesn't matter. If the business goes out of business because there's not enough revenue coming in, those 50 or 250 or however many people you're taking care of, they all suffer because they now have to find care from someone else. All of those caregivers who are working have to get rehired by someone else, and that becomes the issue. So we have to make sure that we're looking at all payer sources. Now, these are the payer sources from the people that were surveyed. And I'll tell you right now, if you are a Medicaid agency, I know based on the Medicaid regulations that you qualify for Medicare Advantage plan. Medicare Advantage pays a lot more than Medicaid. Look into getting that type of reimbursement on top of the Medicaid. So I'm not telling you to drop the Medicaid. Keep doing it, keep serving it, but bring in other payer sources to help with those margins. I can also tell you right now, if you're accepting Medicaid and you're billing Medicaid directly, then you also qualify for long-term care insurance. Long-term care insurance will reimburse you whatever your private pay rate is. That is huge. Now, with the long-term care insurance being just like Medicaid, you are going to have to front the money you're paying your caregiver, so it's practices that you're already doing, and then you receive the reimbursement 30 to 90 days later after you've provided the care. So you're already used to doing it, but now instead of getting whatever the Medicaid reimbursement is, you're going to be getting your private pay rate from those long-term care insurance providers. That is tremendous. All you got to do is get an assignment of benefits form. You have a patient that signs up, you get the assignment of benefits, and then you give them whatever care that they need up to that max daily benefit. And don't take the max daily benefit, by the way. Like, do the honorable, do the right thing. If somebody needs 20 hours a week of care, give them 20 hours a week of care, even though the reimbursement might be higher than that, because eventually that reimbursement will run out. So make sure you do right by your patients, and I know that you do. I know that you do. So we're on record here. I want to go on record saying that, because I don't believe in price gouging or doing anything unethical when it comes to getting business. Do right by your patients, take care of them, serve them, and the universe, I'm a person of faith, God will take care of you, right? So that's the way that goes. And then your veterans assistance as well. The veterans benefit, the aid and attendance program is better than the Medicaid in most states. So you want to work with those as well. And that's not even talking about private pay. I'm just talking about these other payer sources. Obviously, private pay, you have the most control because you're billing your patients weekly and you're receiving that money weekly. And it's at your current rate, not the Medicaid reimbursement. Most of you have a much higher private pay. I find around the country, it's about $4 an hour more for your private pay than your Medicaid rate. So by growing your private pay alongside with your Medicaid, that allows you to get that margin so that your caregiver wages is 50% or even lower of your total annual revenue. That sets your business up for future scalability and growth. Opening up a second location, giving raises to your staff. Maybe setting aside some money for retirement one day, right? Like, you know, we have to think about these things. When you look at your clients, I was talking to my chiropractor earlier this morning when I went to see him, and we were talking about the future. And I said, you know, he's like, you're a fit guy. Like, I underneath this, I have a Superman shirt on, but it's like one of those skin tight muscle shirts where it's a compression shirt because I'm going to go to the gym after we're finished later on this afternoon. And he's like, you're a pretty fit guy. And I was telling him that when I used to work in healthcare, I saw people who didn't take care of themselves coming on healthcare services way too young, in their 50s and 60s. And the one thing they had in common versus the people in their 80s and 90s is the people in their 50s and 60s didn't take care of themselves. I don't want that to be me, so I made lifestyle changes so that hopefully, God willing, I don't need help until I'm in my 80s or 90s myself. And then maybe one of you could help me, right? So that's that. Moving forward to consumer marketing. So if we're going to continue to grow our business and we're going to do things to grow the private pay side and grow the veterans and grow the long-term care insurance, I have to do marketing strategies to get those type of patients to come to my business, to come to my organization, so that I can grow that alongside my Medicaid. And we'll come to some Medicaid stuff in a moment here, but I want to talk about the whole thing. I'm trying to help set your business up for long-term success and take away any worries or issues or concerns that you might have right now. And so this is straight again from the Home Care Pulse report that came out on Tuesday. You know, these are the top 10 consumer marketing referral sources, all right? And the way that they do this, and I like the way that they do this here, they ask people, if you add up this column here, this will give you almost 100%. Meaning that the people who filled it out, a certain number of them said, this was my number one direct-to-consumer referral source. And then this second column over here is what percentage of the total annual revenue that referral source type or that advertising type brought into my business. So without a doubt, the thing that we all should be spending money on, and maybe your website needs a facelift. When was the last time you've updated your website? Websites, the technology, the coding, the Google Analytics, and all that other stuff that goes behind the scenes, the stuff that 99% of us have no idea about, really does make a difference and an impact, and it updates fairly regularly. So maybe it's time to get a new website. But you know, almost 20% of the people, 1 in 5, 1 in 6, said that their website, their SEO, was the number one referral source from the direct-to-consumer side marketing. That was good for 20% of their revenue. So if you don't have private pay revenue coming in, and you would like to get some private pay revenue coming in, or even more Medicaid business for that matter, take a look at your website and consider updating it, because 20% of your annual revenue is a significant portion of your revenue that could be coming in from your website. Another one that I want to point out, and that really kind of took me for a second, was this one down here, newspapers. And I was like, they still make newspapers, right? Every newspaper that I know doesn't have an actual newspaper anymore. It's all online, and maybe that's how it is. But it was interesting enough to find that just under 4% of all the companies surveyed said that their newspapers was their best referral source to consumers for new business. But then it was almost a quarter of their revenue came from the newspapers. And then I started to think to myself, well, who's looking at a newspaper? And then I started to think, this makes a lot of sense. It's the elderly. So when you're doing your advertising, okay, that's what this is. You have to think, who is the audience I'm trying to reach? Technology, Facebook is another one that you see right here, right? Only almost 9%, almost 10% said Facebook was their best one, but it gave a 28% return on investment. That's a lot of revenue, almost 30% of your revenue from Facebook. This is going to be adult children. You're not going to see many 80, 90-year-olds on Facebook surfing Facebook daily and talking the latest slang and learning stuff. But their children who are in their 40s and 50s, maybe early 60s, yeah, they're on Facebook, so that makes sense. So when I place ads on Facebook, it's to make sure the ads are targeting adult children. Newspapers, That's going to be our seniors themselves, our 65 plus that still get the newspapers, that look in the newspaper every day like they did for the last 25, 30 years. They're not going to be on social media. They're not going to be on the internet. They're going to go the old-fashioned route, which is totally fine. And you want to make ads towards providing care for your neighbor, providing care for your spouse, your significant other, or for a friend. Those are the ads you want to create to get the business to come in from that payer source or that referral source type. Moving on, again, for time restraints here, direct referral marketing. Direct referral marketing is going to be the biggest impact to your business. Think about what we do. We are in health care. All right, so being in healthcare, everything is referral based. Example, I actually have a very, very, very minor case of ulcerative colitis. Like, it's nothing blown out. I don't have to get surgery. I don't have to take medication for it. I can manage it through diet. But when I first had these issues of the ulcerative colitis, I ended up going to my primary care physician. And I said, my stomach is hurting, I'm having problems with the bathroom and blah, 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 whatever, not to get gross or anything, but just let him know. And he goes, I'm going to make a recommendation, a referral for you to see a gastroenterologist. The gastroenterologist did an endoscopy and a colonoscopy and found out that I had ulcerative colitis. And then they gave me a treatment plan that I can do, that I don't need to be on medication for it for the rest of my life. And hopefully, God willing, I never will have to go on medication for it. But the reason why I'm bringing that up is because how did I get to the solution? Through a referral that was made from my physician to see a specialist. The same thing happens with us in the private pay world and the Medicaid world. Like right now, many of us are getting our business through the MCOs, right? And the people are assigned to us. You can direct referral market directly to a hospital, and that hospital can find a patient that has Medicaid and send them to you. I have a huge $20 million a year client, mostly Medicaid, in Maryland, who came on services to work with me to grow his private pay, and we have been working with him to help him grow his private pay and his Medicaid simultaneously through the marketing effort. So when they go into skilled nursing facilities and LTACs and hospitals and rehab centers, they're talking about the private pay and the Medicaid. They're representing both, and they're getting both type of referrals. They're usually getting 2 to 1, 2 Medicaids for every private pay, but they're growing both parts of the business simultaneously through the direct referral marketing effort. Direct referral marketing is going to be the most effective form of it because you're going to get qualified leads. Your marketing representatives, or you yourselves who may do the marketing, when you're speaking to a social worker, a discharge planner, a director of nursing, a unit manager, an administrator, a director of therapy, about your services and how you do things, you're explaining who your target customer is and who you'd like to see more of. They understand that you are a resource to them, and then they start referring you the kind of business that you're after. And that's how this works. So what are the best referral sources for direct referral marketing? Well, it's right here up on the screen. Obviously, taking care of clients is going to give you business. So I'm not going to talk about that. All right, you see state Medicaid programs. That's what we're talking about. Area on aging and veterans. I'm not going to talk about that. But if you look at all these other ones, healthcare professionals, all right, physicians are number 10. Skilled nursing facilities, my $5 million, 100% private pay business back in 2009, 10, and 11, before we sold it, that's when we were doing that kind of revenue, most of my business came from skilled nursing facilities. A big, significant portion of it came from skilled nursing facilities. When you find skilled nursing facilities that are discharging 50, 80 patients a month, every month, that's 600, 700 patients a year. You can easily obtain 5, 10 new clients every month from one well-qualified skilled nursing facility. You look at hospice. What I love about hospice is many times hospice gets people who should be on hospice, but they're not ready to take that next level of services. They're not ready. The family's not ready to leave. The patient's not ready to go on hospice. And so what is the person who has need for hospice, but not ready emotionally and subjectively, heart, to take that next step to do? They have a need. That's you. That's your business. What about the person who comes on hospice and they are getting the skilled benefit, but they need more custodial care? What does that person do? The hospice makes the recommendation and a referral to you and your company, and you take care of that patient. Assisted living communities. You're not going to find a lot of Medicaid in assisted living. You're going to find private pay, though. And what I love about the assisted livings with the private pay side of it, they did the hard part of qualifying the person financially. If somebody's living in an assisted living, you know they can afford the services because they're paying to live in the assisted living. Some states have a Medicaid spend down or you have to have like 10% of your assisted living be Medicaid, but the majority of people in there are private pay. So if you get in tight with an assisted living, you may only get 4 or 5 patients in that community. But those 4 or 5 patients are with you for their entire rest of their life. And each patient could be generating 20, 30, 40, 50, $60,000 a year in revenue. So you could have 4 or 5 patients bringing in $250,000 in revenue to your organization from that assisted living. That's a fantastic referral source. Hospitals, obviously, they have the volume and they have the need. They're dealing with patients every single day, all day, every day. They're discharging them. The average hospital around the country discharges around 2,400 patients a year. That's 200 patients a month. You can easily get 10 to 20 private pay patients and probably like 30 or 40 Medicaid patients a month from one hospital in your area. It is absolutely imperative that you get into hospitals and get those direct referrals from those case managers and those discharge planners, and you'll get more notice from them. You will, because the social worker, the doctor makes the rounds in the hospital and says patient X is going home today and they're going to need help. And then that social worker will call you immediately, 10, 11 o'clock in the morning, so that you can be ready to begin care at 7 o'clock that night or first thing the next morning. You'll get more notice if you're getting it directly from the hospital versus through your managed care organizations, where the social worker calls them and then they start making the calls and it slows you're taking the middleman out. That's what you're doing. You can get the patient, start screening and doing everything else, then have your operation reach out to the Medicaid side of it just to dot the I's and cross the T's to make sure you get paid on it. That's what we do with all of our clients here at Hurricane Marketing Enterprises, all right? And so when you have your coaching sessions, go over that, ask the coaches how to get into these accounts to get the business. And last is the home health. You know, when you think about what we do as Medicaid, custodial care providers, as private pay service providers, we're providing the wraparound to the skilled care. The home health, the number one actual referral source itself, type on this list, they make up what I call the 3-legged bar stool of home-based providers. We are the home care, the custodial care. Hospice is another leg, and home health is the other leg. The 3 of us form what I call an interdisciplinary team. And so when you're talking about creating what I call power partners, right? Because it's all about power partners with your marketing during a lockdown. You may think to yourself, I can't walk into an assisted living today because they're not letting people in. I can't walk into a hospital today because they won't let people in. I can't walk into a skilled nursing facility because they won't let people just walk in and come in and market anymore. How am I supposed to do all the things you're saying, Steve? That's why I'm giving you a coaching session, because I don't know if you realize this or not, but majority of the industry right now, the Home Care Pulse Report, they did a survey, and I don't have it up here. Actually, you know what? I will. I'll bring this up right now. So I can get out of this screenshot. You're on my computer. So let me show you a graphic. As it's loading. So let me show you a graphic. This is straight from Home Care Pulse, all right? 65% of our industry has seen a downward trend in demand for home care services since COVID-19 pandemic began. 65%. saw a downward trend. That is huge. People were afraid of having their loved ones have a caregiver coming into the house. People were laid off, so they went into the house and started taking care of people. And I'm sure many of you experienced this as well. Very few people, less than 20%, has seen an increase in business, less than 20%. But let me show you my clients' statistics. 90% either maintained or saw growth during this pandemic. I had clients, many of my clients, 10%, tell me that their best months in business were March, bested by April, bested by May. So their 3 best months in business were March, April, and May, and here we are in June, and they're just building upon it. One of my clients added 800 billable hours a week last week from her marketing effort, because we're helping people figure out ways to get into these referral sources through power partnerships, through collaborations, through events, through activities, and yes, even still getting lunch and learn in services to talk about the services and the specialty programs and all the things that we offer to continue to bring that business in. And the reason why, I'll tell you, the reason why my clients are getting there's such influx is now their competitors who aren't working with us, they don't know how to get into the accounts and market, but my clients are still getting in the accounts, and they're the only ones that they see, so they're getting all the business. And here's what this graphic looks like overlapped, right? People hurting, people remaining the same, people growing, right? I want you to be in this blue here. All right, and here are some pictures. Don't take my word for it. People are doing events. They're raising, getting food drives and doing social distance gatherings outside and delivering PPE. And here's one of my clients in Minneapolis, Minnesota, that made the newspaper, got his aunt to make masks to deliver to the hospitals and the rehabs in the area, and use that to help pull the weight and do their part, but in exchange, they're getting business from it. And so that's the reason why I'm doing this for you. Here we are, it's 12:38, so I know I'm at the end of my time. We're gonna start taking some questions, but do not forget, all right, you all have a free gift. I'm giving this to you. I want you to take advantage of this. How the heck am I gonna, what kind of events should I organize? How am I gonna be able to market and get into these accounts that are currently locked down? Get on the phone with one of my coaches, do a share screen, do it right. You email us, we'll give you a form to fill out because we need your contact information, and we'll call you, we'll schedule it. We'll give you a link so that you can do a share screen because you want to be on a computer, not in your car driving. If I'm going to give this to you, take it seriously. Owners, all right, this is for you. Your marketing reps, the two of you together, be on there because we're going to tell you to do things that's unorthodox. You're not used to doing this stuff. So I don't want me telling, I'm not gonna let my coaches tell your marketing rep to do something without you being aware of it, because if you're not aware of it, you might not let them do it. You got to be aware of it so you know what's going on. You got to be a part of what they're doing, all right? These are difficult times. And so it takes everybody, a team, to be able to get the business that we're after. Your participation is mandatory, but get on these coaching sessions. It's 45 minutes to an hour long. And we're going to give you the plan to help you turn things around and get your business going, and we'll go from there. That's my thank you from me to you for being on this webinar with me live. So, Ken, are you there, my friend?
I am here, my friend. Hey, this has been really fantastic. I'm sure that we're going to have lots of a reach out for more, and so thank you for all that, Steve. Really, really fantastic. So I'm going to steal the screen back for 1 second, and but definitely take advantage of what Steve did. And by the way, Steve, I think that you blasted out to about 100 and I don't know. I think we have 25 more today for you. I guess that's the bottom line I wanted to share. So we will make sure that you get to extend that offer to other individuals, and thank you for that.
Do you want me to send? Should I make a Joel the presenter, or did you get it back? You got it back. Okay.
Yeah, I think I got it back, and I will jump over to sharing my screen and my PowerPoint. I just had a quick thank you slide I wanted to share, and then we'll wrap up for today. But yeah, so thank you to Steve, and thank you to all of you for joining. I think without further ado, we will kind of let you go for today.